Hi, I am Clinical Clerk Montalban, and I will be demonstrating the essential intrapartum newborn care, which we refer to as EINC. To start, let me prepare the materials. Lay out 3 pairs of surgical gloves, 2 of which will be used by the obstetrician, while the remaining pair is for the pediatrician. 2 warm blankets, a bonnet, the cord care set, the erythromycin, vitamin K, and hepatitis B shot. Make sure to wash your hands following the prescribed hand washing protocol. Put on both sets of gloves. This is what we call the double gloving step. During the first 3 minutes within birth, here are the correct procedures prescribed by the Essential Newborn Care Protocol. Baby out, 7:33 a.m. Once the baby is delivered from the perineum, call out the time of birth. Use the first linen to towel dry the body of the newborn. Dry the baby for at least 30 seconds to stimulate the baby to breathe. Do not wipe off the vernix. Do not wash the baby within the first 6 hours of life because it can lead to hypothermia and infection. Carry out a rapid assessment of the baby's breathing. Then remove the wet cloth. Initiate the skin-to-skin contact by placing the baby prone on the mother's abdomen or between her breasts. Place the bonnet on the newborn's head, then use the second linen to cover the baby's back to keep it warm. Then remove the first set of gloves prior to handling of the cord. Do not cut the cord immediately. Allow the cord pulsations to stop without milking the cord to prevent anemia and intraventricular hemorrhages. Clamp the cord at 2 cm from the base of the umbilicus, and the second clamp at 5 cm from the base of the umbilicus, then cut the cord. Inject 10 IU oxytocin into the mother's arm to prevent uterine atony. Also check the mother's condition and then deliver the placenta. Examine her perineum, vagina, and vulva for tears. Clean the mother and keep her comfortable. At about 30 minutes to an hour after birth, the baby will start licking, rooting, and do tongue movements, which are cues that it is already ready to breastfeed. After the baby completes the first breastfeed, carry out the eye care procedures and administer the vaccines. The baby may be washed after at least 6 hours. To summarize the procedures done as outlined in the Essential Newborn Care, we should do immediate and thorough drying together with the assessment of breathing and tone. We should also do early skin-to-skin contact, a properly timed cord clamping, non-separation for the initiation of early breastfeeding, carrying out of eye care and immunization procedures, rooming in, and exclusive breastfeeding for 6 months. By following these protocols, we would be able to reach the Millennium Developmental Goal of reducing child mortality in the country.